The WHO pandemic treaty was adopted. What does it mean for Canada? So this is I'm going to go down to the bottom. So this, after 3 years of negotiations, the World Health Organization has formally adopted a legally binding agreement aiming to improve member countries' pandemic preparedness and response. We'll skip down here to the requirements. The pandemic treaty builds on the international health regulations that were adopted in 2005, which created a legal framework that defined countries' rights and obligations in handling public health events and emergencies. The new agreement calls for countries to adopt the One Health approach, which involves recognizing that human health is closely linked and interdependent with the health of the wider environment and ecosystems. It calls for a multi-sectoral approach to preventing and responding to pandemics. I mean, it sounds like they could use climate.
Yeah. I mean, remember the clip we played where Greta was, basically combining climate and the pandemic together?
By signing the agreement, Canada agrees to strengthen its pandemic surveillance and develop a national plan that coordinates sectors such as health, agriculture, and the environment to detect infectious diseases. The environment there again. Canada also agrees to strengthen and maintain a resilient healthcare system, reinforce its supply chains for pandemic-related health products, improve national health information systems in accordance with its laws, and provide decent work and safe and healthy environment for essential workers during pandemics. The agreement also requires Canada to strengthen public health literacy and provide timely and accurate information around pandemics and public safety. It calls for the country to use regulatory measures to respond to substandard and falsified pandemic-related health products during pandemics. What do you think they're talking about there?
I don't know.
Ivermectin.
Yeah.
The treaty requires drug manufacturers to sign legally binding contracts with the WHO to allocate up to 20% of their vaccines, therapeutics, and tests to the organization during a pandemic, which would then be distributed to developing countries. It says each country should avoid maintaining stockpiles of pandemic-related health products that unnecessarily exceed the quantities anticipated to be needed. The treaty also establishes a conference of the parties that will examine how the agreement is being implemented and review its functioning every 5 years. All countries will periodically report to this governing body on how it is implementing the agreement and may, in response, adopt measures to help their countries meet the obligations. The pandemic agreement notes that it does not give WHO the authority to control or dictate how the countries carry out their laws. It also does not allow it to impose any requirements that parties take specific actions, such as banning travelers, implementing lockdowns, or imposing vaccine mandates. While the agreement states that all countries agree on the need to refrain from taking actions that adversely affect their preparedness and response to pandemics, it states that the countries have the right to implement health measures in accordance with their relevant national law and obligations under international law. The agreement states that 2 years after entering into the pandemic agreement, any country may withdraw. 2 years? Why do you got to wait 2 years? The Canadian government has been supportive of the pandemic agreement from the beginning of the process. Canada was one of the WHO member states that agreed in December 21 to launch an intergovernmental negotiating body to help the agreement. So,
of course we did, because we send WHO money all the time through global affairs,
Yeah, exactly. So there you have it. That one's been in it's funny because it's been in the windshield for a long time, and we finally just got there.
Yeah. Well, they kind of, I think they messed it up a couple times, but so Canada has sent to the WHO 18 million annually, then biennium. What's a biennium? Wow. 2 years, 175 million we sent. Yeah, that's pretty crazy. We also sent 100 million to the WHO for health systems and response connector. Like, it's just a racket, eh?
It's a racket. That's a pretty good word for it, I would say.
It's just a racket. Then they come back and give us a treaty that we have to follow after we spend hundreds of millions with them. Thanks, Canada.
There you have it. I guess we'll call that a wrap. Check out the a-list.ca if you want to support us. Like, subscribe, comment, and share the YouTube. Check out all our other stuff at gramerica.ca, adultbrain.ca for all the audiobooks, and contact@thecabin.com for all the trips and events. Other than that, we